see either, my understanding here just is that there is a server, but there is other smaller servers, the interface. There are places you go here, you see a server hanging out from the wall, completely unsafe. Like any, I don't want to say bad word, I have a counsel to say it, but people can go in there with an internet cable there and a laptop and connect it. So we make a big deal about,
security
OTP cards and 2FA, and you have like servers hanging out from the wall in the hospital. You know what I mean? It's kind of a very, very paradoxical.
Okay.
That's a very good point. And I just want to ask, because I'm getting right now the voice of the staff, that I don't know if it's within your means to explain on the investigation, but was this off speculation? Do we have actual grounds to have done this? Or is this
what do you mean by speculation?
Is this somebody complaining that I believe somebody breached our system?
No, we would not have involved the FBI if it had been as much a rumor. We have information that breach occurred and that multiple breaches occurred. So this is where we get into it, and let me touch on the notification aspects. For everybody that's here, I don't know if you know, but we are under a Guam law obligation to notify individuals and the general public pursuant to 9 GCA Chapter 48, which has been what we've been looking at. I have to be really careful here because I want to make sure that the FBI and any third-party vendors that we bring in to be able to do a forensic review of this, and if there is evidence somewhere not located on Guam, then it can be recovered pursuant to a criminal investigation. And I know that this is probably going to make it into the public, so that's fine. So I have to be careful with what I say. But what we've found is that, and I was texting trying to find out about CareView, it looks like part of the CareView going down at certain terminals may have been connected to some of the breaches that we have seen. That's been part of the problem that we've had, is that our IT has been, we brought the nature of the breach. It was described to us. The breaches itself were a function of a security flaw in the system. And that's
your system or our system?
Our system.
So there's breaches, and I'm not very technological, but so they breached, but was anything stolen?
We don't have evidence of that, and we have been looking for that specifically.
Because patients' lives and safety and state over a breach.
And
we don't know if, for example, if patient data might have been copied. It might have.
Well, I have been told, and I am not a security expert by any means, so this is what I have been told, and this is what I am basing my legal analysis on. That, because of the way that our firewalls were set up, that if there were any type of data removal from the patient health records, the employee records, or the financials, that we would have seen it out going through the firewall, even if the individual is able to breach the firewall in this case. But we don't have evidence of that right now. But we are going to be looking into having a third-party vendor come in with a greater degree of expertise. We have Homeland Security right now on site working with our IT team, and their experts are also looking through our system.
The entire week.
And we're also hoping that the FBI will be, we expect the FBI to come here and take a forensic look at our system as well.
So you have suspected, and you mentioned it earlier, that the system has been breached before, right? There have been breaches.
They have. They stole radiology data.
Okay. So if the system has been breached before.
Let me be very clear. Thursday night of last week, IT discovered the breaches. They found evidence of multiple breaches. They also found evidence that some of the network storms that we were experiencing were connected to the breaches. They looked at the firewalls, and they looked for evidence of patient data, employee health records, financial information being removed off of it, because of course, whenever our systems are breached, that is the thing that we are most concerned about in the initial stages, is making sure that none of that gets out onto the web. What I am told is that we have really good questions, but again, I can't answer those questions because we are in the the middle of an investigation with the FBI.
Theo?
Sorry, just before we continue, we're getting reports that there's some lag, so try talking slowly. But also, we also turned off the video. But also, we do still have two people in the Zoom room.
Right, with their hands up. Okay.
Yeah.
I believe Eric Lee, and then I think Danielle also had her hand up. Okay. Eric, William, go ahead.
Hey, good evening, everybody. I just want to reiterate just the fact that, everybody should know me, should have known in the past that I was a patient safety officer, and I will have to agree and concur with both Bill and Liv that I've been a nurse for 22 years, and I've worked at least 50 different hospitals, and we've had breaches before, and those breaches were very brief and very short. I am scheduled to work tomorrow, and in 22 years' time, this is the first time I have ever dreaded going into work. I have physically dreaded having to go in tomorrow, knowing that all of our patients that's in the hospital at this moment are at risk. This is totally beyond unacceptable. It is beyond a disaster. This is something that is required to be seen about at the moment. We cannot continue to do this. This is not safe. Last week we had patients that didn't even have the armband to be able to allow them to have blood product. I actually physically went to go try to get the blood product, and they denied me because we didn't have anything to verify who that patient is. How can we continue to do this and render the safest care that we can? There's no way in the world we can. And I agree with both Bill and Liv that administration is not where they need to be. And after 50 hospitals, I can assure you that I have seen administration 20 times stronger than what our administration is at the moment. So I'm going to make it brief. I just feel like we need to really have a sit down, come to Jesus meeting with administration to figure out who is truly in here for GMH, because I do not see the backing up of our administration, just as Bill and Liv have talked about. This is unbelievable that this can happen to us. And in 22 years again, this is the first time I have ever dreaded having to go into work. It's just uncalled for. And I'm still in disbelief.
So while I'm sitting here as legal, I don't have any real authority over policy. My job is to make recommendations. I don't have a staff. But while I'm sitting here listening to everyone, and I'm about to agree with you. Okay? So how would we formulate this? So my proposal that I've been jotting down here on a piece of paper and showing to Dr. Prince and Dr. Uggins, speaking with our risk management officer and the director, is this. And it is in the nascent stages. It needs to be worked on. It needs to be formalized as a policy. But my proposal is this, that we form an after-action committee made up of staff, not admin. Staff that experience what has been and is going on right now. Staff that has gone through this last week, and give them the resources necessary to meet in private to discuss and raise the issues amongst themselves. The administration will commit to allowing them to prepare a report on the failures that they see, including in the administration and in the day-to-day operations in a crisis, because if anything good is going to come out of this, we need to make sure that we're prepared for the next crisis, especially the walkie-talkies. I think that's a kind of a thing that I didn't see, and I'm kind of embarrassed by that. This committee would be figuring out who would be on the committee would be something that we need to iron out, but it would be made up purely of non-administrative staff. If the committee accepts me, I would act as a de facto secretary with the agreement that I would keep the committee's reporting and meetings confidential from everybody else. That's my job as an attorney. Again, I don't serve the director, I serve the institution. And then the report, along with suggestions, will be made to the Board of Trustees, and the administration will commit itself to following the suggestions within the boundaries of the law, and that would be the other thing that I would be there on the committee to help with, is to advise on what can and cannot be done legally. But we would put that together. I would do all the typing, and that report would come together and then issue. This is a town.
I appreciate that, Jeremiah. But the one thing that I'm going to agree with Liv and Bell about is if you knew, if there is a iota that someone has broke and breached our system, then you should have initiated. There should have been somebody initiating an incident command center that day. We should have not waited. This is just like the typhoons. You should have initiated that moment that you knew that. Even coming in the next day, we were all helter-skelter trying to figure out where we were at and what we needed to do for that day and to protect our patients. That is not nursing. That is not medicine. That is not how it's done. Legally wise, I understand that you're there to help us and protect the hospital, but that is not appropriate. It is appropriate to have an incident center at that moment when you already knew that this was going to happen.
Okay.
Totally agree with you. I can't go back in time and do that, and I'm telling you that I'm agreeing with the criticism, and I'm sitting here looking at the rest of the admin that is agreeing with that. You're right. All I can do is propose possible ways to make something good come out of this in the future, and allowing staff to have the greatest amount of actual impact and to have their voices heard, and to not only just have voices heard, but to have a commitment from the administration to put policy changes in place going forward that would prevent the actual, if we have not this event, but a similar event necessitating, if God forbid we have a typhoon or some kind of attack on the island, that we have those systems in place that would allow us to continue to operate to the greatest level, so that we are not caught as flat-footed as we were.
And I think it
That's
means that it's not so important what we're trying to get across of how unsafe our practices have been in the last 7 days. And I don't think that you guys are understanding that, because there are so many minute things that could have gone wrong, that are wrong with our practice in the last 7 days, in the conditions that we've been working under, that you, if you were in our shoes, would have said, no security breach is more important than this patient's life. And we're the only ones that can see that for ourselves. We can tell you all we want. We can explain the details, down to the fact that Pyxis is on override and the doctor orders metoprolol 25 milligrams PO. I can override extended release or rapid. That's medication error in itself. That's the simplest example I can give you of how unsafe the practices have been in the last 7 days. And I don't think we can drill it in your head enough.
I understand, Jeremiah, you have a responsibility for the legal aspect of this chaotic situation. My next question is, okay, so something like this happens. Ms. Little, you're head of your CEO of the hospital. Obviously, in these extensive discussions, you were involved, correct? Who's representing where's the ladder here? So it's Jeremiah and you make this decision to shut down. Who's the next? Where are representatives for nursing?
You guys didn't stop to think, hey,
I'm sorry, but who? That's a genuine question. Who is is it Christine? Is it you?
Yes.
Is it, so in this extensive discussion, where was your voice to say, hit the brakes? We have this is going to be a fiasco on the floor. So I think the bottom line goes down to our leadership. Where is the voice for the staff in these extensive discussions that we're having? To voice, you're the voice for the nurses. So where was that?
And I feel you guys. Trust me. I've been trying to communicate everything as best I can. In the beginning, when we were told we were going to shut down, there was very little time. It was actually already decided that we had to shut down. There was no time to plan. It was so emergently presented that it was already decided to shut. So there was no planning. There wasn't even any time to see if there was. I didn't even know if it was going to affect the phone lines at that time.
So
So what
But when it did is when we started assessing.
That's still not appropriate. That's still not appropriate for leadership. Even if in the essence of having something like this happen, your responsibility is directly to your staff, and that staff did not get the information. The staff was under the impression that it was just a 48-hour issue that we had no clue was going to go into further days, and even now into a week. I mean, that's not even acceptable, Christy. And you know, as a nurse, that is not an acceptable method.
We were told that it was 48 hours from our IT. That is accurate. That was not a misrepresentation. That was not a deception. That when we were looking at the system being shut down, it was Saturday. We looked at the weekend. We were told that it would be back up as late as Monday morning at 8 a.m.
But I'm sorry, I'm in the leaders chat, and the only thing we've been getting from IT is text messages. That is very unprofessional for the information to be disseminated via a text message. Where are the memos for the staff? Why are they not going out every time an update is made or a change? Staff ask me every 5 minutes, when is the system coming up? When is the system coming up? When is the system coming up? Put yourself in my shoes. When you have 30 staff and you asking the same question and you have 0 answers. Pending updates. That's an unacceptable answer. Pending updates.
But it probably should have been pending investigation.
Data, employee data, or financials have been removed. And I'm just saying that because those are the areas. We don't have any information that other data such as like network code or anything else has been removed either. And again, we're working with the FBI to make sure that is the truth going on, because it's not, there's no green light within our system that says this patient's data has been messed with, this patient data has not been messed with. But I've grilled our IT people pretty heavily on this topic because we have to inform the public and the individuals if their data was breached. But we have not been given any indication that data breach was either accessed and then acquired, is what the statute states. Is it possible that it could have been accessed? Yes, but we don't have evidence of that, according to the people who have been looking at it. Is there any evidence that any data has been acquired, copied, removed from our system? No, not yet. That may change, and it may change going forward. And as soon as we find evidence of that, we have to comply with the statute or face criminal sanctions. So that we are not withholding and have not been withholding that information in order to facilitate the investigation. There's no evidence of that so far that I have been made aware of. And as soon as I'm made aware of,